in order is to tell you guys about the chi-square test of association. So we'll see the test of associations today, and probably I think we will be able to cover the three chi-square test of association and its two variant, which is chi-square test of homogeneity and chi-square test goodness of fit. So we'll see these one by one. First, I will tell you regarding the basics of these three tests, and then I'll demonstrate you. If time permits, we'll go to the breakout room. If not, we will start with the breakout room activity on Monday. Let's see. So, till now, you guys have done the descriptive statistics, and in descriptive statistics, in the basics of descriptive, we have learned that descriptive statistics is something when you describe or summarize the data, but you don't infer about the population. And that's why it is accurate. But again, there is a problem that you cannot tell about the population from where you have withdrawn the sample. Whereas in inferential statistics, you can always infer about the population. And the first in this thing is, and that's why there is always a null hypothesis and an alternate hypothesis in all these inferential statistics. So from now onwards, for all these 3.5 days, we will talk about the inferential statistics, and that's why we will talk about a null hypothesis and an alternate hypothesis. So let's start with the chi-square test of association. So chi-square test of association, inherently it says that it is a non-parametric test. And right now we have just discussed regarding the normality and regarding the parametric versus non-parametric. So we will be talking briefly about the basic concepts of this chi-square test of association, the various research questions which we can address through this chi-square test of association, what are the assumptions and hypotheses. So from now onwards, we will always talk of assumptions, because testing those assumptions is very important before you proceed to apply any test. Then only your interpretation will make some sense. And then what are the commands, how to interpret those commands, and then I'll summarize those commands at the end. So this is my research question. I want to know about the association between the gender and diabetes, because in this data collection also, what you people have filled out the form, we have collected your diabetes status and I have got the gender also. So if I want to know regarding whether any association between gender or diabetes is not, then again, this can be a good test to know about the association. For example, if I have conducted one study, and how will I conduct this study? So this is more about the methodology. Why? Because in chi-square, how you conduct the study, that also determines which type of test are you going to apply. So you first ask from all people, like, what is your gender? And then you ask, are you a diabetic or not? So you are collecting the data in a cross-section way, and you make contingency table. So what is a contingency table? So contingency table is also known as the cross table or cross tab or a two-way table. And it is an arrangement in which the data is classified according to the two categorical variable. There can be various levels of categorical variable. That means if it is a gender, when it has got only two levels, male and female, it is known as the binomial variable. If it has got more than two, like if I write like male, female, and transgender, it has got more than two levels. So it is known as the polytomous variable. So any categorical variable which has got more than two number of levels, then it is known as the polytomous variable. So like this is a 2 by 2 table, whereas you can see in column there is a status of diabetes, and in row it is the gender. So generally, how to keep these row and column? So generally, remember the mnemonic DC. So DC and AC current we used to study. So generally, we dependent variable, we put it in column. So always these independent variable like the socio-demographic variables, we take it as an independent variable. So male and female is independent, and then diabetes is the dependent variable. So that's why I have put diabetes in column and this gender in rows. Similarly, BMI category, I am using this BMI category as an independent. So I have put it in rows, and then column I have put the diabetes. So this is a 3x2 contingency table. Now these are the three tables, and you can see that male and female. So now it's just see this table for a few seconds. So now first concentrate on table number 1. So table number 1 is like you can see out of 80 men, 40 are diabetic and 40 non-diabetic. Out of 50 women, 25 are diabetic and 25 are non-diabetic. In table 2, if you see, out of 80, 45 are diabetic and 35 non-diabetic. And in female, 20 are diabetic and 30 non-diabetic. If you see the table number 3, 60 male are diabetic and 20 non-diabetic. Similarly, 10 female are diabetic and 40 non-diabetic. So if you just see this table, even without statistical test, can you guess like where there won't be any association, there will be some association, and there will be strong association between gender and diabetes status? Yes? So 1, 2, 3. First is no. Second is moderate. Table 3 is strong association. Yes, all of you are right. True. Because you can see like here, irrespective of the gender, the proportion of diabetes is same. Here there's a difference, and here there's a lot difference. So that's why we can say that gender and diabetes are associated. So you have said it rightly. No association, some association, and there's a strong association. So what are the various research questions for which we can use? So first is like if I want to know the relationship between the BMI category, where I have classified the BMI as normal, overweight and obese, and history of cardiovascular disease, like maybe absent and present. It has got 2 levels. The second research question could be if I want to know the association between the surgical technique X and surgical technique Y and the occurrence of surgical site infection. Or if I want to know the about the quality of sleep and academic performance. So I have classified the quality of sleep as good versus poor, and academic performance again as good versus poor of medical undergraduates. So if my research question is falling into any of these lines, so in all these research questions, what I have observed, that there are 2 categorical variable in all these, and all the categorical variable has got more than 2 levels. So there are 2 categorical variable, and we are trying to look at the association between these 2 variable. So what is the appropriate statistical test? So the appropriate statistical test is the chi-square test of association. So association, we say that when they both are linked together, and independence, it is also known as the independence. If they are not associated, that means they are independent of each other. So you can choose any of these, both are same, association or independence. But here, if it is associated, you cannot say that this is causal. You cannot say that the female gender is causal for the diabetes. So that's why association does not indicate causality. So what are underlying assumptions? So the first assumption is like there should be 2 categorical variables. So remember, chi-square test cannot be applied on continuous variable, because you need 2x2 table for this, and 2 by n table. It's not only 2x2, it can be 2x3 or 3x3, but it should be a categorical variable. And the second, we write that there should be 2 or more categories of each variable. So it should be either a binomial variable or it should be a polytomous variable. And then The third is your independence of observation. And I'll explain this independence of observation. What is this independence of observation? So this independence of observation is like if I have counted one individual once, I will not count that individual again. For example, let's say if I'm doing a survey of, let's say, I just want to see again the same question, association of diabetes between gender and gender. So what I did, I took 50 couples. So I took 50 male, all the husbands, and 50 females, all the wives. And then I have asked regarding whether they are suffering from diabetes or not. So is this assumption is valid? Independence of observation? What is your comment? Yes, please type in the chat box. Can you please just put up the chat box here? Okay, so are you asking me to repeat the question, Dr. Hilda? Dr. Hilda Priya?
Yes, ma'am. Yes, ma'am.
Okay. So I asked the question like the same association which we started, like association between gender and diabetes, right? So what I did, I have like contacted 50 couples, husband and wife. I have recruited 50 males in one group and 50 females in the other group. I mean, all the wives. So I have taken the observation from each couple. And then I have made 2 by 2 contingency table. And then probably I have like, let's say, out of 50 couple, if like 10 of the couple, they didn't have the wife at home at that time. So let's say 50 male and 40 female, right? And I made contingency tables regarding the status of diabetes present or not. So this example of independence of observation, are my observations independent? Yes, first answer yes or no, and then we will talk about the reasons. Are my observations independent? So you people are answering no. Why no? Because there can be various reasons. Like if there are husband and wife, of course they are not related, genetically, but there will be behavioral characteristics. Yes, socioeconomic, dietary pattern, lifestyle, sleeping time, screen time, physical activity. Because husband and wife influence each other. So the observation which I am making, that is not independent. Or if I have like, there are many twin studies. So in my study, let's say if I have if there are 4 are twin pair, like I have contacted people where the 2 are twin, like one male and one female, and I have included both of them. So I have counted one person in category of female and one person in category of male. So is this assumption independence of observation valid here? Please answer yes and no. So Dr. Neeti is writing no, Dr. Hilda no, Dr. Surbhi is no. So very right. So then what do we mean by independence of observation? Means these subjects which we recruit, they should not be related to each other. Related means maybe husband and wife, maybe the twin, or maybe the brother, sister, something like that. They should not be related, although the gender might be different. So that is one point. This is regarding the independence of observation. Again, this we observed in one of my PG thesis. So one of my PG was doing a thesis on the prevalence of depression, prevalence of antenatal depression in women attending the rural area, rural antenatal clinic, right? So she was taking the data, and like there can be a case where one female she interviewed came in second trimester and she has given the history. Again, that same woman again came in third trimester, probably towards the end. And if my PG takes, her name is Supriya, then my PG. So if Supriya takes that antenatal women again, because if she has not made anything like ID, or if there is no leading question that have you responded to this question, or have you to this form, have you filled this form previously, and if such question is not there, there are high chances that one antenatal woman will be counted for more than one time, because she is coming repeatedly, that antenatal woman. So in that case, I might count one woman for more than one time. So then my observations are not independent. The way we do in HIV sentinel surveillance, remember we always put a date of HIV sentinel surveillance, and we ask from the women, like there might be a case that that same woman has given her sample twice, but we ask like whether you have given the sample in this year or not. And if she says yes, then we don't include that woman. So these all are examples of independence of observation. That means if I have counted that individual once in my study, because it's a cross-sectional study, then I'm not going to count that woman or that participant again. Or I will not take anyone who is related to each other. That we mean by independence of observation. Am I making myself clear? Because in most of the workshop, generally the participant is having difficulty in understanding this assumption. So this time maybe we have given two more examples of like this cross-sectional study, and that we observed in our thesis also, that was happening. Means I don't know whether that was happening or not, but we did not put a leading question in the beginning, right? What is YED, Dr. Thilen? Okay. So yes. So next is it should, okay, thank you. So the next should be, it should be a relatively large sample size. Why large sample size? Because we'll see the next assumption, which says that the expected count should be more than 5 in each cell. And for that, if your sample size is less, then probably that will not be fulfilled. So again, coming to the independence of observation, there's no relation. We assume that there is no relationship between the subjects in each group. And if there are a relationship, we call these observations as paired. So the categorical value variable should not be paired. And now relatively large sample size, like I said, at least expected cell count in each cell should be at least 1, and expected frequency in each cell should be at least 5, well, like 80% of the cell. Now I have introduced this term expected versus observed count. What is this? So this expected, like if you go by the statistical formula that says like, row total into column total by sum total, but I don't want to go by that statistical formula of expected count. Right now, we just want to introduce the concept, the intuitive meaning of what do we mean by expected. Observed is what you see. Okay. So let's understand this with one example. So like if in the same data set which I have, which we have collected, if I want to know like what is the proportion of hypertension, and is it significantly different from national prevalence, because there is a national prevalence of hypertension also. And this data, I assume, although I have not followed a sample size and the sampling strategy, but let's assume that I have taken care of those methodological issues, and I want to see whether how this sample is different from a national average. So according to National Family Health Survey, the prevalence of hypertension in India is 22.6%. So the total sample of this data set is 170. Now, can I calculate the expected number of hypertension cases in our data set? Can I do that? Yes. Please answer yes or no. So Dr. Sunil Kumar is writing, Dr. Neeti, Shweta, Jyoti. Okay. So expected will be 170 into 22.6, which is 38. So this is the expected number of hypertensive patients, hypertension study subjects in this data set of 170. Okay. But what was the observed? If you see this, observed was 31. So if you calculate the percentage, means out of 170, 31 were hypertensive. So if I calculate the percentage, what is the percentage of observed? It is 18%. So there is a difference of 4% between the observed and expected. So now this we understand by the expected and observed. So first, have you understood this? How do we calculate expected and what is observed? If yes, then I'll move to the next next concept of in a 2x2 table. Okay. Now, if like next question, okay, Jyoti, Hilda, they are saying yes. So I'm moving ahead. So if it says like, is there any association between gender and hypertension status? So now focus for a few minutes here. So this is my overall result. So out of 170, so this is 170, which is my total number. And I have got this 31 as hypertensive and 139 as non-hypertensive. Okay. And now coming to next, if I take out the proportion, you know that 18% are hypertensive. Okay. In my case. So it is 18% hypertensive and 82% non-hypertensive. Now, what the null hypothesis assumes? So I have not talked about null hypothesis, but null hypothesis in this case assumes that there is no association between the gender and hypertension, right? That means whatever is the prevalence of hypertension overall, the gender-wise will also be the same proportion. Okay. So if I go by the null hypothesis, so what will be the proportion across gender? So it will be like same. It is 82 and 18%. So the same proportion will be maintained because there is no association with gender. So 82% and 18%, no, 82% no, and 18% yes. Okay, if I go by the null hypothesis. Because null hypothesis says that there is no association. So if there is no association, this same percentage will be maintained here also and here also. Are you getting this? Up till this point. Please answer yes and no. Yes. Okay, Dr. Sunil, Dr. Hilda said yes. Now, if you apply the same proportion to this, because total number of female is 63 and total number of female is 107 and total number of male is 163. Males were more, na? So maybe probably like numbers, typo error is there. It's female are less and male is more. Okay. So if I apply same proportion, this 18% and 82%. So all of you, please calculate what will be the 18% of 107. Yes, I know that, but I don't want them to show now. You please calculate.
107.
Okay. Whatever is there. So you calculate the 18% of 107. What will be that? 19.2. Okay, now it is okay. 107 male and female. Okay. So yes, 19. It is right. 19. What you said now. 107. They were male like this 19. Okay. So this is your expected count. Similarly, if you count 82% of 107, I mean, remaining percent will come as this. No, this remaining number. So remaining number will come here as no. Yes, 87.7, it will be 88. Similarly, if you count 18% of 63, it will be 11. So this is your expected count. Okay, this is your expected count based on null hypothesis. But if you make 2 by 2 contingency table, your actual count is this. So this is your observed count from the data set. From the null hypothesis, this is your expected count. Here it is 88, here it is 19. Whereas your observed count from the data is 80 from the data and 27 from the data. So there is a difference. Can you see there is a difference of 8 here in first cell, and there's a difference of probably let's say 9, 8 again here. And similarly, there is a difference 11 and 7, 7, and here again 7. So if you see this, if you count the difference, this is these are the like expected, this is your expected and this is your observed. And we want to know the difference between these two. Because if you can recall the chi-square formula, which we are not telling you that observed minus expected, we square it and then we take the sum and divide it by the, and then calculate the chi-square value and divide it by the expected. So basically you calculate this difference between observed and expected. So this is -8, this is 8, this is 7, and this is -7. So bigger the difference is, bigger will be the chi-square. Why? Because you are squaring it. So even if it is in minus, when you square this, it becomes plus. So larger the difference, more is the value of chi-square. Okay. So this is the concept of observed versus expected count. And whenever we talk about assumption, we tell that the expected count in each cell should not be should not be 0, and in 80% of the cell it should be more than 5. This should be this is one of the assumption before you go for the chi-square test of association. So have you understood up till this point what is the observed count?
Can you repeat that last sentence, ma'am? Can you please repeat that last sentence,
Yes.
what you said?
So I was telling you, this is your expected, what we have calculated like 82% and 18%, and this is your observed. So you take the difference between two. So what is the difference of 8 number in the first cell, which is -8, this is +8, this is again 7 and 7 in both these cells, and we square it. So what I was telling you, larger the difference between observed and expected, larger will be the value of chi-square. And larger is the value of chi-square, that much significance you will achieve. Because you know that for achieving a 0.05, the minimum value of chi-square should be 3.84. So if it is more than that, higher the value of chi-square, more significance will add. What is the intuitive meaning? Larger the difference between observed and expected. And that's what you did now in the first table. Remember, you have seen 3 tables where you were just seeing the number, where everything was equal. And you said that you don't expect any association. Why? Because it was almost same. So, but that was observed. See, here we are talking about the expected. And that I again said that that's why one of the assumption is like this cell count, and this is the whatever cell count we say, that is expected, that is not observed. So expected cell count in each of these cells. So this is my expected. So in each of these cells, expected count should not be 0. And at least in 80% of the cell, it should be more than 5. What if it is a 2 by 2 table? So at least we accept that in 3 cell, the count will be more than 5. And that's why we say that relatively it should be a large sample size. Large means like we say that it should be more than 30, 40, because we say that in less than 30, then you cannot go for many, because that distribution, we talk about those distributions. I don't want to talk about those concepts now, but it should have a relatively large sample size, because then this assumption of like expected cell count in 80% of the cell of more than 5 will not be fulfilled. Okay. Have you understood?
Yes, ma'am. Yes, ma'am. Thank you.
Okay, okay. Anybody who wants me to repeat something or to tell, because then I'll again go to the Jamovi and I'll show the same thing there also, because there is an option. You can click the expected count and you can see what is the expected count, and then you can check for those assumptions. So Dr. Shweta is writing yes. Yes means understood.
Hello. Hello, ma'am.
Yes, please.
Ma'am, this 80% cells more than 5 character I can't get, madam. Can you?
Okay, 80% means in 2 by 2 table, what will be the 80% of 2 by 2? Total cell is 4. So if you calculate 80% means that talks about larger tables. You will see many times what our PG does. I remember one of the PG, he came with 9 by 8 table. Means there were 9 multiplied by 8, 63. Yes, in Jamovi, I will explain on the same data set. Don't worry. So let's say if it is a 5 by 5 table. So how many cells are there? 25. So right now, I think you are getting confused with 80%. So what will be the, yes, 25. What will be the 80% of 25? Let me calculate this. Wait here. So let's say it is, I have diabetes and BMI. 3 by 2 table is there. So total number, let's say 25, I have given example. Okay. Somebody has written. So 25 multiplied by 0.8. So it is 20. That means in 20 cells, the expected count should be more than 5. Or I will explain this with the table also. Let's say this is a 2 by 2 table. So in 4, if let's say this is our 4, total number of cell is 4. 4 multiplied by 0.8. Number of cell is 3, at least 3. That means in all these 4 cells, even if you see these 3 cells, is there any cell where the expected count is less than 5? Focus on this table. No. That means my this assumption is met. Okay. If in 80% of the cell, 80% depends like what is the actual number of cell. Actual number of cell depends the contingency table. If it is a 2 by 2 table, that means there are 4 cells like this 1, 2, 3 and 4. If it is a 3 by 2 table, then there will be 6 cells. We will see more this in Jamovi. But have you understood up till this point about the 80% thing? Okay.
Yes, ma'am.
Okay. So now this is about the, so what is the null hypothesis? So the null hypothesis is like hypertension, if you see, look at this. So there is no relationship between the variable. An alternate hypothesis says that there is a relationship between the variable. So I've told you regarding the concept of expected frequency. So expected frequency is defined as the count in each cell if the null hypothesis is true, right? Now there is something known as the strength of association. So what is this strength of association? So this is also known as the, if you see phi or Kramer V, or this is again known as the effect size in chi-square. So if the value of this phi in Kramer V is 0.1, it is small association. If it is medium, moderate, and if it is large, it is like 0.5, then it is a large association. And this we only click in the chi-square if the chi-square value is significant. If it is not significant, if the statistical significance is not there, we don't see the effect size. So it is only seen or clicked when the chi-square value is significant. Okay. So before I move to the other type of chi-square, let me show this, demonstrate one test so that this concept of expected cell frequency becomes clear. So how will I go? In the analysis, this is the frequency. So this frequency you can see here, there's a binomial test and there's chi-square goodness of fit. Similarly here, it is an independent sample t-test. So I have clicked this independent sample t-test. So in frequency, you click on this independent sample t-test and this option appears. So it got duplicated because originally I have clicked one. So if you click this, now let's see, I want to see like, I believe that women, they take more time in commuting as compared to men. Okay. So I want to see the association between gender and commuting time. Okay. So what I did, I have put gender and gender is my independent variable. So I have put that in row and dependent variable, I have put it in column. So my column is the commuting time. So it is my category of commuting time. So this is my count. So now can you tell me how many cells are there in this contingency table? All of you please write in the chat box. How many cells? 4, 6, 9. So there are 9. See 3 by 2, na? We take number of tables. So there are 3 levels. 30 to 60, less than 30 and more than 60. And this female and male are 2. So it is 6, right? Let me correct this order of variable. This less than 60, I'll go to the variable and I'll click this commute time. And this less than 60 will go up. Yes. Now it is okay. Less than 60, 30 to 60 and more than 60. So if you, now this is the count which you are seeing like 15, 33, 15, 33, 65, 9. Can you please tell me what this count is? Is this expected count or is this observed count? Yes. Kaushik is writing observed, Kirti is writing observed, Divya is writing observed. True. Very right. Now, I want to see, right now I'm not clicking on percentage, but yes. So this is your row percentage. And generally we calculate row percentage. And this you can see here as expected counts. Counts, can you see there is option? Observed count is by default checked. But if before you go for the chi-square test, you should click this expected count also. So I have clicked this expected count. And now you can see the expected count. So in the first cell, you can see that this is the difference, 15 and 17.7. In the second, it is 33 and 36.2. Here it is 15 and 8.9. And you can apply the same proportion first. Let me ask from you people. So this was the overall proportion. So can you calculate 14% of this 63? All of you please calculate 14% of this 63. And please type in the chat box. Nine. Okay, so you can see it is approximately 8.89. It is also 9. Similarly, if you calculate like 58% of 63, again, it will be 36.32. So this percentage, which you can see here, this expected, this one, 17.79, 36.32. This is maintaining the same percentage as you can see here, this one. Okay. So now you can see about the expected cell count. So in each of these cell count, can you see here, you can see 17, 36, 8. Here you can see 30, 61, 15, 48, 98, 24. So none of the cell frequency has a count of less than 5. So this assumption is met. So after I have seen this, I will uncheck this. Because in table, generally we don't give this expected count. We only say that the assumption of this minimum cell count of 5 in majority of the cell that has been met, and that's why you have now decided to go for a chi-square. Because if they are not met, then we need to go for other type of tests, which you can see here, like chi-square continuity correction. Because if the count is less than 5, then you will click on this chi-square test of continuity correction. And then you report that value of chi-square. So now this you have done, and then again you can go and see the. So what you see, the p-value is significant. So if the p-value is significant, then you can click on this phi and Kramer V, which is the effect size. And then you can see the value. So why it is 5 is coming NaN? Because phi is reported only in 2/2 table. So we will report Kramer V. So Kramer V is 0.2. And what was the value of Kramer V which we took? So if it is more than 0.2 up till 0.3, we call it as a medium or moderate. So I'll call it as a moderate association. But that we see only when the chi-square value is significant. So this is about the expected count and the observed count. But again, if the chi-square is not significant, you don't need to report on this phi and Kramer V, that is the effect size. So then you can say, like, how will you interpret the result? Here you will see like 14%. There are 24. So I will focus more on this, where a commuting time is more than 60 minutes. So 24% of the female are taking, like 1/4 of the female are taking more than an hour to commute, whereas it is only 8% in case of men. That means 1/3 of that proportion, because 8% is 1/3 of 24. So only 8% of men are taking time more than 1 hour to commute, whereas 25% of females are taking more than 60 minutes. Because the other percentages are not that difference. And this chi-square value significant is also based on this value only. Other you see the difference is not that much. It is 52%, 30 to 60 minutes. Here also it is 61%. Here it is 24%. Less female are reaching quick, like less than 30 minutes, where it is 31% men are reaching in less than 30 minutes. So this is how you will write the interpretation of this contingency table. Then you will write that this overall, there is an association between the commuting time and gender, which was significant, and having a moderate strength, because the Kramer V value is 0.2. Have you got it up till this point?
Ma'am, so actually we should report the phi and Kramer value also, because usually we don't do that.
You should do when it is significant.
Okay, ma'am.
Because generally you will see, like these days always we report the effect size. We have kept one very brief session on effect size on probably Monday, where we'll tell why it is important to report effect size, why only p-value is not sufficient.
Okay,
Because
ma'am.
for evidence-based medicine, if you want something, and even like in this era of meta-analysis, you know that all the meta-analysis that is done on the basis of effect size. Because effect size conveys the meaning regarding your clinical judgment, whether you should, use or you should not use that particular information in your patient care. So that's why generally I know that people don't use it. But if you go by the standard, people like we learned for this whole exercise on the chi-square and this test of association. And they recommend it, and we encourage here our PGs also. So generally, we encourage them to report it. But of course, many times what they do, they click this in spite of having a non-significant chi-square. Just be careful in that. Because if there is a statistical significance, then only you comment about the effect size. If the
Okay.
statistical significance is not there, then there's no need.
Okay. Thank you, ma'am. Got it.
Actually, these days you will see like if you see the journals, the standard journals, generally the chi-square, it is not very much. I mean, yes, for beginners they do it, but independently chi-square you will not see. Generally, for homogeneity we see, because in randomized control trial we do apply, but chi-square test of association generally it's more for a postgraduate students, where at least we expect them to apply this much. But of course, yes, you can go in the papers also in manuscript, but generally in manuscript, we don't have a research question specifically related to this, test of association. But for PGs, yes, we have, and there can be subset of main questions also. And we do encourage reporting the effect size, definitely. So yes, any questions before we go to the another, that is the chi-square test of homogeneity or two proportion? Okay. So have you understood now what is expected count and what is a observed count? What is what is this assumption about like? And yes, one more thing, we will see that also in some other example regarding this. So I told you, like, since our sample size is very good, it is 170. So you will never put this chi-square continuity correction. But if the sample size is less, so in any of the cell, that happens with many of our PG thesis. So if it is a n by n table, then you will go for this chi-square continuity correction. But if it is a 2 by 2 table, then you go for this Fisher exact test. So in case of because Fisher exact test can be applied only if it is a 2 by 2 table. If it is a n by n table, means 3 by 2 or 3 by 3 or 4 by 3, then we apply the chi-square continuity correction, which is also many people say that as a Yates correction. Traditionally, we have been reading that Yates correction is this chi-square continuity correction only. And then this is a Fisher exact test. Okay. So this now coming to the other session, that is on chi-square test of two proportion. So this chi-square test of two proportion, generally which one? Which can this be done if the sample is less than 30? Yes, they do it. Especially if you see like people from biochemistry and microbiology, when their samples are very less. Many times we have seen samples like 20, 22, 16. So if you make 2 by 2 table in 16, definitely there will be one count where it will be less than 5, one cell. So in that case, generally we go by this Fisher exact test, the value of this Fisher exact. Okay, yeah, if the sample size is less than 30, there are high chances that one of the cell or two of the cell will have a cell count less than 5. Okay. So chi-square test of two proportion, it is again a variant of chi-square test. The basic difference is regarding the methodology. Methodology means how you collect your sample. So again, this session we'll talk about the brief concept, what are the research questions, assumptions and hypothesis, commands and interpretation, and the summary. So the chi-square test of two proportion, here since beginning we have got two independent groups, right? So whenever we do the sampling, we generally, how do? We take the whole sample and then we make the two groups. But this is known as that's why the name, if you see the name of this test, it is known as the chi-square test of two proportion. So this 2 proportion, what you see here, that is regarding a binomial proportion. We'll see that. And then the other is there should be dichotomous dependent variable. And this chi-square test of 2 proportion, it can be applied only if there are 2 independent groups and the variable which I am assessing that has got 2 level. That means binomial proportion, and it is also called as the chi-square test of homogeneity. Now, what is a binomial proportion? So, like for example, I have for any let's say the MI attack, I have recruited equal number of male and female, 50 males and 50 females, and I want to see the proportion of myocardial infarction in males. Is there any difference of proportion in these two groups? So if 4 female had got heart attack in 50, so what will be the proportion of women who are having heart attack? So it will be 4 by 50, so it will be 0.08. And what will be the proportion of males having heart attack? It will be 0.16. So what will be the proportion of female not having heart attack? So it will be like 92%, opposite of 8 will be the 92%. If you see here, if it is 8% is female having heart attack, then 92% is female not having heart attack. So this is known as the binomial proportion. Similarly, here the males are having heart attack and 84% are not having heart attack. So this is known as the what? It is again, it is the binomial proportion. So here the 2 independent groups are the females and males. Okay. So we have recruited them separately. And here also, we will make sure that there should be independence of observation. Means I cannot recruit 50 couple, put 50 females in one group and put another 50 males in another group. No. Then that independence of observation assumption will not be met. And then the 2 proportion is the binomial proportion. So what are the various research questions? If I want to know whether the proportion of BMI, and here I should have only 2 categories. So I cannot do this BMI into my obese, normal and overweight. So I have made the category of normal and high. So this is a binomial proportion, normal or high, of MBBS students of AIIMS Patna and AIIMS Delhi. So these 2 are independent group. I have taken students from AIIMS Patna. I have taken students from AIIMS Delhi. So 2 independent group. So dental studies are mostly less than 30. So example of what, Dr. Suman, means cross tab you want to say. Less than 30 you can go for with the Fisher exam. I will tell you with one of the example. Here we don't have any sample where 30 is there, but we can create data for you probably on Monday. Right now we don't have a data set of 20 or 25, but we will show this in less than 30 to you on Monday. Will that be okay? So now the next research question is like whether the surgical site infection rate, which is present or absent, again it is a binomial proportion this much in 2 units, unit 1 and unit 2 of a surgery department. So again these are 2 independent samples. And COVID cases in rural and urban population, again 2 independent samples. So what we have observed that in all these 3 cases, I want to know whether the proportion of various categories of a nominal variable or an ordinal variable is equal across different population. And the appropriate statistical test for such type of this thing is also known as the chi-square test of 2 proportion. Why 2 proportion? Because it is a binomial proportion. Something is there and something is not there. So how it is different from chi-square test of association? So the most important characteristics is the sampling. So how you do your chi-square test of association? So you go to the group of people and you assess their diabetes status and you assess their obesity status. So you start with one population and then you see the association. In chi-square test of two proportion, you start with two different set of population. So you recruit people from non-obese and you recruit people from obese. And then you see the proportion of diabetes in these two groups. So what are the underlying assumption? Again, the independent variable and dependent variable both should have two levels. That means it should be a binomial variable. And then there should be independence of observation. We have discussed about this, so I'm not repeating this. And it is only used in certain type of research design. Because this independence of proportion, generally for a classical cross-sectional study, you start with one population. So you have to see the methodology, how they have recruited or how you have. So if your study question or research question warrants the use of such test, then definitely you can use this. And again, the same expected count should be greater than 5. So null and alternate hypothesis, you say that the binomial proportion, which is the presence of something and absence of something, of the variable of interest in the two population is equal. And the alternate hypothesis says that this is not equal. So it can be used in certain type of research design. The first type of research got a group of nurses and I've got a group of doctors. So I've recruited the doctors from doctor group and nurses from nursing group, and I have seen the presence of diabetes. So, and if I see like compare the proportion of this diabetes in both the group, then I can apply this chi-square test of two proportion. Similarly, if it can be done in case of a randomized control trial. So if there is a random assignment of people to intervention group or to the two control group or to the two intervention group, and you see the outcome which is categorical in nature, presence of something and absence of something, and you compare the proportion in these two groups, then again you can apply the chi-square test of two proportion. So if you see the demo, this option, Z test of two proportion. In case of chi-square test of two proportion, we'll click on this. So let me see what are the questions for the chi-square test of two proportion. Yes, here we have not done. No, maybe we can do like two independent groups, like the research participants as well as non-research participants. I don't know whether we can classify the data like that. Let me see if we have any question. No, we don't have any. Single proportion we have. No, this is risk. No, this is not. Okay, so right now I am for demonstration, I am showing you, but generally we have not done it like that. So let's see. I will just move this back. The question is there any significant difference in the proportion of dietary preferences, veg versus non-veg, between males and females? So I'll put gender here in the rows. So this, oh yes, so let me see. Screen time, hypertension. Let's say hypertension. Okay, hypertension is also having. So let me see the variables where I can apply. So edit. Let me see now. Age. Because it should have two levels. So I'm just seeing what are the two levels. Monthly expenses, category, all levels are RH status. Let's take this. Gender and the RH status, okay? So I'll go, if I want to say what is the proportion of RH positivity, it is same in male and female. So how will I do that? I will take this gender in row and this RH positivity in column. Right, because I've started with male and female separately and I want to see whether it is RH positive and negative status. Although RH negative are again, it is there. So instead of this chi-square, I will go for this Z test of difference of two proportion. And then you can see, first you check for the this expected count. So I'll go and see this expected count. So in this case, you see that expected is 4.82 here, 8.81, 98 and 58. So assumption is met because in 80%, which is the 3 cells, the count is more than 5. So I can go with this chi-squared Z test of two proportion. So this Z test you can see. Now first describe the proportion. So if you see the females, the percentage of negative is 6%, whereas in male it is 8%. Although there is a difference of 2%, but that 2% is not significant. And if it is not significant, here, I won't go with this phi and Kramer V because this is only important when this p-value is significant. So this is how we go for. So remember, for chi-square test of two proportion, both should have a 2 category. It should not have more than 2. And so this was regarding the chi-square test of two proportion. Now there is another thing which is the chi-square goodness of fit. लेकिन वो तो पता नहीं है, बस हो गया ये बता के. Then after this, I think after demonstrating this, we can end the workshop and then we again meet on. So what do you want? I should not be telling this? Okay. What about what is the opinion? The way you direct me, I don't have an issue. We can take this session on Monday also if you guys are saturated or tired. Monday. Okay. Okay. Continue is also there. Now that makes me confused. What to do now? Because if you ask, please continue. So what I'll do, in 5 minutes, I'll continue and again I'll redo this on Monday also. So this is the chi-square test of goodness of fit. Remember here in chi-square test of goodness of fit, you start with one proportion. Okay. So this is the general slide which we have kept everywhere. So here what you see that we see the distribution of case and in the single categorical variable. And we see whether it follows a certain distribution or not. So that distribution can be known. Like we have just given the example of NFHS5 data, where you have seen that 18% were 22% were hypertensive, and rest of them were non-hypertensive. So if I want to see in my population whether my population is behaving same way, then I can go with this goodness of it. Single proportion, only single proportion. So this you can see here. That's why its name is chi-square test of this goodness of fit, or we also call it as a chi-square test of single proportion. So it says the distribution can be known. Like in case of hypertension, I know that NFHS data says that 22% are hypertensive and rest are not hypertensive. But it can be not known also. So if it is not known, then the software assumes it to be equal. So if you don't give any percentage, it will consider that 50-50. Or if it is 4, it depends on the category. If there are 4 levels, like let's say blood group where there is a AB and ABO and O, then it takes 25% of each category. So now depending on the number of categories, so if there are 3 levels like normal, overweight and obese. So it takes like 33, 3 percentages. So let's say if I say that the prevalence of obesity is 5% in Indian children, and in my study 18 cases of obesity are there. So there are 25 cases of obesity in my sample. So this number is significantly different from the expected. So this is counted as the same way, the expected which we have shown you with that NFHS example. So if I want to know whether the proportion of BMI categories of MBBS student of my college is different from the normal proportion, then I can use this. Whether the surgical site infection rate of my ward is different from the overall surgical site infection rate, or whether the passing percentage of my college is higher than the minimum desired or the university, overall university. So in all these examples, what we have seen that there are various categories of a nominal variable, and we want to compare this against a known or a hypothesized proportion. So chi-square goodness of fit is the appropriate test, or it is also known as the one sample chi-square test, because you only need one variable for this, that is the proportion. So again, the basic assumption is there should be one categorical variable. Independence of observation, which we have talked, that is here applicable to, and expected frequency should be at least 5 in each group. So like if there is a hypothesized proportion, you give that proportion. If not, you assume it to be equal proportion. So like, for example, I will give you or let's say I will take just of two proportion. So this, if you go to the JAMOV, there is an option of frequency here. And here, this option of N outcome, goodness of fit. So like, how will I go? I will click this goodness of fit, and I'm taking the same example of hypertension, NFHS data. So how will I do? I will take, because you can see there's only one window here. So I will put this hypertension. No, but hypertension we don't. Okay. Think that is okay. So this is hypertensive. Normotensive is, if you see the proportion. Now I have to specify. So this is your observe. Now if you click this, it has taken equal of all these three levels if I don't write the proportion. But if I want to write the proportion, how will I write that? So hypertensive is 18%. So out of, you need to explain the ratio. So let's say I will tell that 2 are normotensive, 1 is pre-hypertensive and 1 is hypertensive. So if I click that, it takes this as a reference and then it calculates this. So it calculates that, it says that 50% should be there as I expected, but it is 35%. Similarly, 25% should be there as a pre-hypertensive, where it is 47% here. So it is when you give the levels of this, and you can see that it is a significant value because chi-square value is significant. So you can say that yes, in your data, whatever you have observed, the values are significant from the national average. So that we mean this option here, that we mean by the normotensive, I mean this expected versus known proportion. So I have given this known. If I don't know this, it takes each level as equal. Like let's say if I just give example of blood group. So a blood group, if I take blood group, and Dr. Shamshad is checking the distribution, the normal distribution of blood group. So if you don't do anything, it will take all these 4 as equal. And then it is showing that, 28% is A, but AB is only 6%. And then you can see it is significant, right? If you know, then you can write the proportion here. So percent, we need to calculate.
30%.
30% means, no, 1/3, no, it is 1/4, no? Ratio will be, like it will be approximately 1.8 or some, 0.33, na? 30% you are saying.
30%.
So it will be 0.3. No, you cannot write 0.3 here, na? You have to like make it in whole number. Here there is a problem that you cannot change this proportion. So you need to know, like, if there are 30%, 30, let's say if it is 50%, A is most common. So you will put this 2 as 2, and then let's say this as AB as 0.5. And this again as 0.5. And this as 1. So now you can see 2, 1, 3, and 4. Yes. So it is significant because proportion what you see here and what is there as a this expected, there's a difference between the two. And if you don't include anything, don't write anything, then it will take all 4 levels as equal, and then it will give you the value of chi-square. So this is the chi-square goodness of fit. So we have discussed 3 types of chi-square test of association, chi-square test of 2 proportion or homogeneity, and chi-square test of goodness of fit or 1 proportion chi-square test. So depending on the various types of research question, you can apply. Most commonly, it is the chi-square test of association, which we use. The other 2 types, homogeneity and goodness of fit, can also be used depending on the need. So this much from our end. We'll share the video. You can practice on the data set. And again, we will meet on Monday at 2 o'clock. And we'll start with I'll just do a quick recap. And this chi-square test of 1 proportion, I'll again revise because there were few candidates who were requesting it to be on Monday. So I'll again take this on Monday. Then we'll have breakout room. Okay. So thank you. Good day to all of you. Happy weekends. And we are ending meeting from our end.